And good evening, Professor Dr. Deepak Jumani. And good evening, all the participants. InnoCase welcomes you on today's webinar series on Sex Has No Expiry Date. And none other than your favorite show in the Pundit at Dr. Ritu Show. Myself, Harish Mehta, working as a marketing manager in InnoCare Life Sciences. And today is my privilege to introduce Dr. Ritu Santwani. Dr. Ritu Santwani, she is MBBS, MD, Obstetrician Gynaecologist. She is IVF specialist. She has a 20 years veteran of obstetrician and gynecology sciences. She is specialized in the TestTube baby and each and every aspect of infertility and provides a comprehensive services in IUI, IVF, ICSI, assisted hatching, egg donation, embryo donation, surrogate motherhood, male infertility, natural infertility treatment, semen banking, embryo freezing, sexual and psychological problems, and try to give moral and emotional supports to our all infertility patients. Welcome you, ma'am.
Thank you. Thank you.
Now it's time to introduce today's Pundit. I request Dr. Ritu Santwani to give a small introduction of Dr. Deepak Jumani.
Yes. Thank you, Harish, for the kind words. A very, very warm welcome to Jumani sir on our show. On a very, very huge demand. This is first time in the history that Jumani sir is on the third time on my show. Sir, a very, very warm welcome. Sir, tahe dil se aapka swagat hai.
Thank you, ma'am.
Yeah. Friends, as all of you know that knowledge is the key to success. With this motto, I keep on inviting the stalwarts from our own fraternity who believe in the knowledge sharing. I am here, your host, Dr. Ritu Santwani from Pune. So our today's Pundit, the Dr. Jumani sir, a very, very great academician, a very brilliant teacher. Sir, though doesn't need any introduction. All of us know the sir very, very well. So sir is that teacher. बोलते हैं ना, हिंदी में 2 लाइन बोलूंगी सर के लिए. ऐसा बोलते हैं कि कुछ होता है कि टीचर आपको सिखाते हैं. कुछ ऐसा होता है कि ऐसा टीचर वो ऐसा बोलता है कि वो सुनने के बाद आपको खुद इच्छा होती है कि आप उस सब्जेक्ट के बारे में और पढ़ें. तो सर is belongs to that. Yeah, can I have a brief biography of sir, Harish?
Yeah. Yes.
Yeah. Please make it full screen.
Yes.
Yeah. So, Professor Deepak Jumani sir is a distinguished senior sexual health physician and counselor from Mumbai, attached to JJ Government Group of Hospitals and Grant Medical College as an assistant professor of medicine, sexual health. He is also attached to Mumbai Police Hospital, Dr. House and Apollo Sugar Clinics as a consultant sexologist. He has his private clinics at Dr. House and My Best Doctor Clinic. At Goregaon, Mumbai. Sir is conferred with the Dronacharya Award. Sir is the chairman of Indian Medical Association Initiative of Sexual Health and a Pan-India sex education program. Sir is the author of the bestseller book, The Manual of Sex Cell Types, that sex is no expiry date. That sir is going to discuss with us today. And Professor Deepak Jumani sir is a stellar personality, a prolific orator, singer, and an avid reader and researcher. Sir has so many awards with him. So this is only a brief introduction of the sir. Sir, a very, very warm welcome to you. Sir, before we start presentation, sir is the teacher of teachers. Sir, I want to know what is the secret of success?
Well, it's God's grace, blessings of my parents, and blessings of my teachers, my mentors, and of course, best wishes of my good friends. All I can say is that I had a very modest beginning when I started. I had 3 teachers who influenced me heavily in my life. And they, in fact, changed the whole perspective of my understanding of practicing medicine. The first teacher was Dr. O.P. Kapoor, who's called the father of medicine, a very senior physician of our country. He taught me how to examine the patient, and he says there is no other joy in medicine. The thrill of medicine is just to examine the patient and come to almost a near diagnosis. You hardly need any investigations. So he is the father of medicine who's taught me how to examine patients, and he influenced me heavily, and he's one of the first mentors of mine. And the second mentor of mine is Dr. Shashank Joshi, who's a leading endocrinologist, a classified cardiometabolic physician of our country. He's a Padma Shri. He taught me the whole endocrinology. And he told me that how endocrine system influences our body. And lastly, my another teacher is Dr. Prakash Kothari, who was the senior most sexologist of our country. He's the one who brought Kama Sutra to the world map. So he picked me up and he said, Deepak, you are a cutout of my branch. You please come in my field. And he called me to KEM, and I worked with him for almost 8 to 10 years in KEM. And he influenced me so much in this particular field that I had to be in his field. And I consider that was the greatest boon and the greatest gift of my life, which I got from him. All the teachings, everything what I learned from him have made me what I am. So my success story is one, I had a passion to do something different than what normal people do. I wanted to have an edge over others. I was committed to my work. I believed in hard work, and I always did hard work and pursued my passion to teach and to learn and to practice. And I always went with one thought in my mind that if you are honest, if you are clean, and if you are ethically correct, nothing can go wrong to you. And these are the principles what, and always beseech my teachers whenever I talk about my lectures or wherever I go. I always pray for my teachers, and I always pray them to bless me always. And that's the secret of my success. Of course, hard work, there is no question about it. There is no shortcut to hard work. One has to be hardworking. One has to be committed. One has to be ethical in his practice, and has to be very clean and honest and transparent. So this is what I learned from my teachers, and I practice, and that's how I am what I am today.
Great, great, sir. Sir, tell me, what motivated you to become a doctor?
Well, this was, we had in school till 11th standard, then we had first year science and inter science. In inter science, we had to take A group or B group. A group was for people who took physics, chemistry, and mathematics. B group was for students who took physics, chemistry, and biology. My both parents are great parents, but they were not literate. They have not even studied, up to matriculate. But I'm very proud of them. They made all we three sons doctors. All their three sons are doctors. I have two younger brothers, both are doctors. So I was very proud of them. They were not literate. They did not guide me. Neither did I know that I would want to be. I had no ambitions to become a doctor. But I had a good friend circle with whom I used to study. And all of them decided to take in inter-science B group, which is biology. So I also took B group, and we were in the same Parle college, which is now Tilak Vidyalaya. So we did B group, and we had physics, chemistry, and biology. And then they all who passed opted for medicine. So I also joined medicines. I had no plans in my past that I would become a doctor or I wanted to be a doctor. I just was working hard to, see that I get good marks, and I used to get good marks. So, but I went because all my good friends who were with me, who were studying with me in my school and of course in college, because they all wanted to go for medicines, I also joined them. So that's how I planned to be a doctor. And following me, my brothers also joined me in medicine.
Okay, great. Sir, please share some tips for the young budding doctors.
See, as I told you, we have to be ethical. And second thing, our profession is noble, but it does require a sacrifice. We need to understand that we have to sacrifice and keep up to the ethos of our profession as noble. Today, I find youngsters, they want fast money. They are aggressive. They are opening posh nursing homes and big hospitals, spending so much. And they all have a lot of loans on them, a lot of money spent. So they all are interested in seeing that how they can, cover up whatever the expenses they are. So they tend to do something which is not correct today, which I'm seeing in our practices today. But what I want them to understand is that we have all learned medicine from the pain, from the diseases and discomfort of our patients, and we should have our commitment or some promise to our moral conscience that whenever anybody comes with a disease, discomfort or pain, we should be available and we should give all out. We should give them something more than what they ask for. And we have chose to be a doctor. We were not told that you will get patients between 9 and 5. We used to work 24/7 in casualties, in our wards, etc. So patients used to come anytime. Today I find doctors switching off their phone after 10 o'clock. No, hamara bhi private life hai, this, and they don't answer. They don't give mobile numbers to their patients. But I feel this is wrong. You chose to be a doctor, and you were told when you were becoming a doctor that you will get patients all out. It is not that you'll get patients between the office hours 9 to 5. So it is your moral duty towards your own conscience to be available to your patients. So this is the second advice I want. And I always want to say hard work is the first thing, the crux of hard work. Be committed, be ethical, and be transparent with your patients. And what I feel is I may not be able to treat everything of my patients who come to me. I may not. Because I'm not everybody. I'm not an orthopedic surgeon. I'm not a cardiologist. I'm not a gynecologist. I'm not a neurologist. There may be some things with my patients who have something which is beyond my understanding or beyond my. But what I want to make my young doctor friends to understand is you have to give them right guidance. You have to be with them in their pain. Even if you are a gynecologist and if your patient has some neurological problem, be with your patients. Try and communicate with the neurologist whom you are referred to and explain to your patients, because your patients will have more faith in you than the doctor whom you refer to. So it's always to be with the patients in whatever thick and thin times he is going through. So this is what and don't run for money. If you are good, if you are ethical, if you are transparent, if you are committed, money will run after you. You don't have to run after money. So this is what is my advice to the younger doctors. And be clinically good. You have to have brilliant clinical acumen and try to diagnose with simple clinical things, not investigations. Don't be investigation centric. You have to increase your clinical acumen and come to the diagnosis. You can aid your diagnosis with investigation. That's fair, that's good, that's ideal, because today we have Consumer Protection Act, so we need to have some documentary evidence, but use your clinical sense, which is very important, to clinch the diagnosis, and that will give you real joy, will really give you peace, what you deserve.
Thank you so much, sir. Friends, now we are going to start the sir's presentation. Those who have any queries, please write in the chat box. After the presentation, I will take the queries. Over to you, sir.
Thank you. My talk today is a very interesting subject. I really enjoy talking on this topic. Because today what I feel is everybody who comes to me, I being having a referral practice, they come with a diagnosis. Sir, I have got erectile dysfunction. There's a referral note that he's got hypoactive sexual desire disorders, or she has vaginismus, or she has this, please treat. But what I want to make you understand is that sexual dysfunctions in men and women are common today. Everyone is having some or the other issues in the bedroom. And today what I have understood is that whatever is with the advancement of medical science, whatever is less in our body, be it hemoglobin, vitamin D, calcium, B12, hormones, we can increase them. And whatever is more in our body, be it sugars, be it blood pressure, be it lipids, be it anything, we can bring it down. So today we can normalize every pathology in a patient's body and make it a normal and give them a physiological way of living, physiological life, and improve their quality of life. Because sexual dysfunctions does affect him, it does affect his partner or her partner and their relationships. So this is very important. And today, when we can correct every cause of sexual dysfunctions which we see in our day-to-day life, be it psychological, be it vasculogenic, be it neurogenic, be it hormonogenic, all these things can be managed. And if you are able to manage everything today, whatever be the etiology, how can sex have an expiry life? So sex has really no expiry date. So in this 30-35 minutes, I'll take you through my, give you a preview or give you a complete know-how of how you can go about it and give your patients a good quality of sex life. And I thank Dr. Ritu, thank InvoCare, thank everybody who is given me an opportunity to be of some help to them, and also giving me an opportunity to share my views, thoughts, concepts, and passion.
Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Gurur Sakshat Parabrahma, Tasmai Shri Guruve Namaha, Tasmai Shri Guruve Namaha.
I thank my teachers, Dr. O.P. Kapoor, Dr. Prakash Kothari, and Dr. Shyam Joshi, and I beseech them to bless me always. We are living in a very, very ambiguous era. It's an era of stress, era of innovations, era of internet, era of competitions, sex-saturated society. We have novel therapies which we see day in and day out. And we have patients who read everything from Google, Yahoo, and they come to us with all the information they have. So we need to be setting up certain standards which are above them. We also need to be updated. If you don't get updated, we will be outdated soon. So we need to have standards of highest order. At the beginning of marriage, every wife treats her husband as God, Pati Parmeshwar. But once he gets married, I don't know, somehow what happens is the words interchange. Why men after 40 change? What urges make men chase women they have no intentions of marrying? It's the same urge that makes dogs chase vehicles they have no intentions of driving. So at 40, if you find somebody, or after 40, you find somebody, so you can understand what are his intents. A beautiful study done says 40% of men above the age of 30 or 40 have some or the other sexual dysfunctions, or they are not satisfied with their sex life. Erectile dysfunction affects 50% of male population over the age of 40. And when I Googled, I found Viagra had 196 million web pages and aspirin had only 43 million web pages. 62% of women across the globe admitted that they were not happy with their sex lives. 50% of married couples in the most developed country like Japan are living a sex-starved life. There have been increased number of divorces, and 1 out of every 5 divorces is due to some or the other issues in the bedroom, and it is usually impotency or some dysfunctions in either men or a woman. Let me give you a newer perspective. According to American Heart Association and American Urologist Association, sex is the best prescription of good health and longevity because it improves every system of our body, be it cardiovascular, respiratory, etc. And it is said you have to use it or you lose it. I find erotic scriptures, even the images of Lord Shiva with erect penis in the temples of Bhubaneswar, in the temples which were built thousands of years ago. And we all know that we are born out of sex. We are not fallen from the tree or cloned or anything. And sex is God made. It is the normal and natural function of our life. And whatever restrictions which we have today, that sex is bad, it's not to be talked about, it's sin, it's dirty, is all man-made. When we look at this image, she is one of the most beautiful women in the history of mankind. She's so beautiful that she's an epitome of passion, love, beauty, and femininity. She was so beautiful that she had so much of confidence and a high attraction for anybody. So much so that she could attract any man at first sight, and he would like to be with her, be intimate with her, or have sex with her. She was so beautiful. She was the goddess of love and beauty, and she could excite everybody on the earth. She was none other than Greek goddess of love, beauty, and sexuality, and her name was Aphrodite. Now, why am I showing you this? What was Aphrodite doing that made everyone attracted or have lust for her? The secret lie in the diet of the metabolic superfoods which she had. She did not go to the parlor, she did not do any makeup, or she did not go into the fitness or shaping centers. She did not undergo bariatric surgery or liposuction, etc. What was her secret was the metabolic superfoods which had. And this ancient diet, the sexiest and the healthiest people took to consume to make them healthier and sexier, is also available to us. Friends, from 9 years to 90 years, the humans can have sex. So there is no age for sex. And there is no time. It could be morning, afternoon, evening. And it has, trust me, at the end of my talk, I'll prove it to you that sex has really no expiry date. We are born because we had a life. This life is because we are born. And one day we are going to die. We have no choices. But whatever happens to us between birth and death, the funda or the A, B, C, D of our life is the choices we make. And we have wisdom. So let's make right choices in life, be it with everything on this earth. And sexual fitness is the lifestyle decision which we all need to make. Now we need to understand what is the art and science of being sexually fit, or to have a good quality of sex life. Please understand, intimacy is ageless. But to ignite intimacy, we need to have strategies of mind and body for getting optimum sexual pleasure. But once if you lose your intimacy, say you have a dysfunction, can your intimacy be ignited or restored? Yes, it can be. So the onus of sexual fitness is with we physicians. When we ask histories about allergies, surgeries, addictions, vices in our patients, we also need to ask him that, do you have problems in making love? Very simple question. And this is one of the key messages I would like to give to every doctor, every gynecologist. Ask your women patients, ask the couple both, that do you have any problems in making love? You have a lot of infertility cases who come to you. Just ask them. You will be surprised that your patients are waiting for you to initiate a dialogue on this aspect. So the onus of sexual health of our patients lies with we physicians. We need to break our barriers and ask them. Every male today has some or the other bedroom woes, and most common in younger people, because they smoke, they watch a lot of porn, they are into drugs, they have a lot of freedom, they have a bad lifestyle. So younger men are suffering more today. A global study done that only 4% of Indian doctors ask the sexual history of it. And this is one aspect. The second aspect is there are 5 cities in the world, in California, Italy, Greece, Costa Rica, and Japan. Here, the average life of every human staying in this city is more than 100 years. And this was detected by Dan Buettner, who is a scientist with National Geographic. And he named these cities as blue zones. And he wrote a beautiful book. And these patients who live, these humans who live for more than 100 years, they had certain patterns of their lifestyle, which he studied. And these are longevity hotspots. But can we make India also a longevity hotspot? Because we are also increasing our life expectancy today. But what we see is that as we grow, our health span is decreased. So there is a break between expectancy, life expectancy and health span. There is a disconnect what we see. Can we bridge this gap between the lifespan and the health span? Yes, we can. And we need to decide how do we want to live 60 plus gifted years, which we are going to. Our average age in today's time is more than 69 years. So all of us are going to live above 70. So how do we want to live these gifted years which we have? Do you want to live with autonomy, dignity, grace, or be happy? Or do you want to be diseased, depressed, dependent, or emotionally be unhappy or crippled or sexually dissatisfied? Men, emotional dysfunction and anxiety is the first room when he enters in a bedroom with his legal wife or illegal wife. So this anxiety or emotional dysfunction which he had is one of the commonest causes of his sexual dysfunction in men. So we need to break all the barriers and ask our patient. Now let me give you a little deeper perspective. Is sexual activity beneficial? Why at all you want to have sex? What is it? Is it of any advantage? So let us understand what is the advantage. Sexual activity is inversely related to mortality. This is a beautiful study done that mortality risk was 50% lower in men who had high frequencies of orgasms. Men reporting intercourse less than 1 per week had twice the incidence of erectile dysfunction, which was studied. No frequency of intercourse is significant predictor of longevity. Early cessation of sex was associated with premature death, and 50% of reduction in cardiovascular disease death were seen if they had 2 orgasms per week. So, beautiful study done. They said sexual activity cannot produce myocardial infarction. This was published in JAMA. So nobody has died of heart attack while having sex. So one should take away this out of his mind that if I do more sex, I'll get a heart attack, or if I do sex, I'll get a heart attack. So I should be careful enough. Of course, there are restrictions, which I'll discuss a little later, but it does not cause heart attack per se. So sex is the best mirror of the rest of your relationship. A beautiful study done in 2009, published in Journal of Sexual Medicine. 8,000 participants of age above 50, 65% were sexually active, 45% of them had sex once a week, 70% said sex was more fulfilling than when they did have when they were young, and 76% felt it wasn't boring as we age. Now we have another patients who are above 60 to 64 years. They said active sex life is very important for their well-being. Amongst them, 78% of the women and 91% of men agreed to them. And also 56% of women said sex was very pleasurable at the age of between 60 and 64, and 81% of men agreed to this. This is a 30-year-old study of patients who were 70 and above. They said they had more sexual satisfaction than what they had when they were younger in age. They had less sexual dysfunctions. They have more positive attitudes towards sexuality. We all have barriers, so patients also have barriers. Patients don't talk about, they feel embarrassed. We health professionals also have barriers. The biggest barrier is time and feeling of embarrassment, on feeling of, suppose he says, what will I do next? So these are the problems which we physicians face. The male and female sexual responses are desire, arousal, orgasm, and pain. And dysfunctions in male can be at any level. It could be at desire level, arousal level, orgasmic level, and pain. In women, it could be at a desire level, arousal level, orgasmic level, or painful. This we all know about it. So what are these are the two. So 4 cardinal events which we need to ask our patients when we take a sexual history is that, do you have a desire? And once a male has a desire, does he get erections? A female, does she get lubrications? Is the male able to penetrate well? Or is the female experiencing the penetration? Or does she have orgasm? Or does a man ejaculate or has orgasms? So these are the 4 cardinal events, and the whole diagnosis of dysfunction can be obtained by asking these questions in details. The common male sexual dysfunctions are erectile dysfunctions, low desire, premature ejaculation, and we have also understood what are the normal changes: less hormones in male and female, less sperms, less penile blood flow, shortening and narrowing of vagina, atrophy of vagina, reduced elasticity, reduced muscle tone. Female sexual dysfunctions, now DSM-5 have merged the hypoactive desire disorders and arousal disorders into female sexual interest disorder. Orgasmic disorders have remained unchanged, and the painful dyspareunia and vaginia, they have merged into genitopelvic pain and penetration disorders. So you have 3 disorders in women also. And what women want? Do they want drugs? Do they want injections? No. They want emotional connect to be more than the therapies. It is so more of psychological impact is there in women when they have no sex or less sex, or they remain starved. So the focus is more on emotional and relationship aspect, which is more important for them. And there is a myth amongst adults that 79% of men above 70 to 90 years and 69%, they had sexual contact and they also masturbated. 86% expressed interest in sex. Two-thirds married respondents said a sexual relationship made their lives meaningful. And 72% said 75-year-old men and women felt and they were really sexy. So elderlies are not interested in sex. It's a myth in all of us. They are equally interested, and why they should not? What is harm in they are interested in sex? There is nothing wrong. So sex is definitely different because you finished all with your course of life, your career, your children are married, children have got all their jobs, you have earned enough. So this is going to be a very different time. It's an experimenting time. It's a golden period for all of us. It need not be peno-vaginal sex. It could be holding each other, spending time with each other, arousing each other, bathing with each other, talking, traveling. So many things which could be non-coital also can be very useful at the age of 60 and above. Men, the first dysfunction is erectile dysfunction. It is multifactorial. These are the causes of it. We all know psychogenic, vasculogenic. Mechanism, we all know it's the endothelial dysfunction. What we have understood is that 70% of all men with erectile dysfunction had cardiovascular disease. So, and the death due to cardiovascular diseases have been the highest in our country. And the other non-communicable disease where patients do have erectile dysfunction is diabetes, hypertension, obesity, and dyslipidemia. There is a big link between erectile dysfunction and cardiovascular diseases, which we know we should connect this missing link. And this missing link is erectile dysfunction, which is the earliest marker of cardiovascular disease. This is what we need to understand. Montessori has beautifully described in his penile, in the artery size hypothesis, that the penile artery is the smallest and the femoral artery is the biggest, and a little higher in diameter is coronary artery. And when atherosclerosis sets in, 50% of the penile artery gets blocked, but doesn't block the 50% of coronary artery because it is high in diameter. So whatever happens in the penile artery, which is because of the 50% of the blockage of penile artery, is erectile dysfunction. And slowly atherosclerosis is progressive. Slowly coronary artery may also get 50% blocked, and the patients may get symptoms of coronary artery disease. But the period is around 2 to 3 years, which we know. So this period of 2 to 3 years, which we get when we diagnose erectile dysfunction as early as possible, is a window period of curability where we can change his lifestyle, counsel him for quitting smoking, control his hypertension, dyslipidemia, hyperglycemia, etc., and reduce the onset of critical events in his life like myocardial infarction or stroke. And when we see a patients of coronary cardiovascular disease as they progress from endothelial dysfunction to cardiovascular disease, throughout we find these patients have got erectile dysfunction. So erectile dysfunction is very important to elicit, to ask your patients about it, because it can give you a clue that this patients will sooner or later get myocardial ischemia. How do we manage? Sexual satisfaction is the must. They all want hardness. We need to do the erection hardness score. 1 to 10 is very severe. 11 to 21 is less severe, moderate. 3 and 4 can be managed without medication, just with counseling, etc. What are the treatment modalities? First is oral therapy, counseling, and lifestyle measures. Second is injection of papaverine in the intracavernous tissue, vacuum therapy, intraurethral prostates, prostaglandins, counseling and lifestyle measures. Of course, if all these fail, we send our patients for implant surgery. Counseling and lifestyle measures are the mainstay of treatment for erectile dysfunction. This is the second take-home message from me. Counseling and lifestyle measures are the mainstay of treatment of patients with sexual dysfunctions, irrespective of whatever dysfunctions they have. All PDE5 inhibitors, we are all aware, we have all the four khans, sildenafil, tadalafil, sildenafil, and vardenafil. But they have a lot of, these are the pharmacotherapies. We have films also available. The newer ones are avanofil, lodenafil, mirodanafil, which will soon hit the market. They have a lot of side effects. The main side effect is headache, backache, visual disturbances. They cannot be given with patients who are on nitrates or having low blood pressure or having anemias of whatever sort. They also develop, some patients have developed melanoma and basal cell carcinoma, but 40% of patients fail because they don't take it in the recommended dose. They take it on full stomach. They take it just few minutes before the activity, and they don't stimulate themselves. So these are the things which we need to counsel our patients to make them more, make their medications more effective. 40% of them don't respond. So what do we have for non-responders? We have films which are available. We have various other regimes. We can give them alternate days medications of tadalafil, but low dose of tadalafil, 5 mg or 10 mg, has been proven to be best in every patient with metabolic syndrome if he doesn't have a contraindication like use of nitrates or any other contraindications. So chronic therapy with PDE5 inhibitors is one of the valid choice. Now let me give you an ethical perspective of ideal sex life. See, we are giving them PDE5 inhibitors for erection. That's not treating the cause of it. Most of these patients have low desire. Now, desire is all because of testosterone. And we also know that endothelial dysfunction results in reduction in nitric oxide. And nitric oxide per se gets reduced as we age. When we will be 60 years of age, we'll have only 15% of nitric oxide. And there exists a therapeutic gap. She has a desire and he doesn't have a desire. And desire is all because of the free testosterone. All diabetics are having low testosterone. It's the free testosterone which is important. It declines as we age and SHBG rises. It declines before FSH and LH start to rise in everybody. So when we replace testosterone, it is having some benefit. Definitely it has benefits and all these things, but they come with a bag of side effects also. And we have definite contraindications of patients getting prostate cancer, breast cancer, BPH, etc. New England Journal also mentioned about patients getting heart failures in whom we treated with testosterone. So we can't give testosterone to younger patients for the fear of their developing azoospermia. We can't give it to elderly because they may develop heart failure or prostatic cancer. So what do? If he has a low desire, do we have something else to give? Yes, we have. We have something better to give is phytonutraceuticals in the form of fenugreek, saponized form. We have L-arginine, which produces nitric oxide, and fenugreek, which replaces the globulin-bound testosterone and makes free testosterone more available. These are all available to us. These are safe. These are medical foods. A lot of studies too. I will not go into the details, but yes, L-arginine with fenugreek, zinc, magnesium, so many other antioxidants which are available today. We can give it to a younger patient and also elderly patients. They are safe. They will not cause heart failure. They will not cause prostatic enlargement, etc. But yes, they will develop good desire and good erections. So we need to decide whether erectile dysfunction is a symptom or a disease. If it is a symptom, give them PDE5 inhibitors. But if you consider it to be disease, we need to give them something which can give them cure. And the regenerative therapies are phytonutraceuticals, herbal medicines, extracorporeal shock therapy, gene therapy, stem cell therapy, and nanoparticles. There are many other therapies which are also come. I will not go into, but they are all in the pipeline. Amongst the regenerative therapy we have today is phytonutraceuticals, herbals, and of course, some studies with stem cell therapy. Now let's talk about the other dysfunction is premature ejaculation. We have a spectrum of ejaculatory disorder. All men suffer from premature ejaculation sometime or the other in their life. It is more common than common cold. It's the time, less than 60 seconds after penetration, the intravaginal latency time, if it is less than 60 minutes, 60 seconds, he is an ejaculator. It's the inability to control his ejaculation and the negative consequences. If his wife is in distress or if he is in distress over a period of 6 months, we definitely label him as a premature ejaculator. DSM-5 clearly mentions about all these things. It's the early short plateau phase which we see. We have a lot of treatments for lifetime PE. We give them SSRIs, tramadol, PD5 inhibitors. We have a lot of applications also available. Beautiful drugs are there, but non-pharmacological techniques, which is itself is a big subject. I can teach some other time when it is available. Masturbation techniques, we can make them understand that when he's having a point of no return, how to control himself. The best drug today we have is Depoxetin, which is 30 to 60 mg, 1 to 3 hours prior to sexual activity, not to be taken more than once in 24 hours, not to be taken with alcohol, proves very good, because if you give it with alcohol, there are a lot of cardiogenic adverse events. And now let us come to what is the key in female sexual dysfunctions, which is very seen. The optimal therapy of female sexual dysfunction is a combination of pharmacological therapy, cognitive behavioral therapy, remove all the risk factors, relation improvements, and sex therapy. Amongst the pharmacological treatment, we have PD5 inhibitors, flibanserin, which is new, which has come now. Botox has been tried in vaginismus, estrogen, testosterone, tibolin, herbal agents, lubricants, repellents. Bupropion is given in patients who have depression with other sexual dysfunctions. What I find today is in women, there is a gender bias. In men, doctors give them testosterone in and out at any age. I have found 15-year, 17-year-old boy who wants to make muscle. He's been given testosterone injections by his gym instructor or maybe his family physician. So many doctors have been, even orthopedic surgeons, they prescribe nandrolone, testosterone to them. I am surprised, why do they give to younger patients? And they don't fear that this testosterone will cause side effects or some complications like cancer or prostate in them. But women are not given hormone replacement therapy because of the fear of cancer. This is a bias which I see. Women are terrified for HRT. Why is this bias? I feel sexually invisible since I got menopausal. So a woman without hormones is like a Ferrari without fuel. So give her hormones, a low short course of hormones, nothing wrong. Give her testosterone, she will feel very good. Give her estrogen gels, no harm in doing all that. So my take home message is, take a detailed history of every aspect, even relationship issues, sleep disorders, etc., and tell your patients to have realistic expectations. Sex at 60, 70 will not be as you were doing when you were 20 and 30. All you know, it may be better because you got more time, you have learned a lot, you have more experience. And make lifestyle as your medicine or as your religion. You may be Hindu, Muslim, Sikh, etc., but make lifestyle as your religion. Diet has to be plant-based food. I really feel that vegetarian diet is the best diet. And if the whole world turns into vegetarianism, the incidences of diseases will reduce drastically, will be zero, I feel. So vegetarian plant-based diet is the best. Exercise, everybody does 150 minutes per week. How is he going to fall sick? How is he going to remain obese? No cost. Sleep 6 to 7 hours or 8 hours. Avoid certain medications which can cause harm. Avoid smoking, alcohol. Reduce the stress in whatever way you can. Increase your family attachment, increase your social attachment, and take certain supplements like L-arginine, fenugreek combinations. The foods which are very good, these are all, some people call it aphrodisiac foods, like red colored vegetables, red colored fruits, green vegetables, cow's ghee, cow's milk, garlic, onion, ginger, sesame seed, flaxseed, saffron, oats, mushroom, vanilla, dark chocolates, almonds, walnut, dates, honey, white of the boiled egg and fish. But according to me, the best aphrodisiac is none of these foods. Of course, these foods are beneficial. All these foods have got positive effect in your body. But according to me, the best aphrodisiac is your own fantasy and your own excited partner. That is the best aphrodisiac you can ever have. And avoid SOS. What is SOS? After 30, you should reduce. S is salt, O is oil, S is sugar. because these three can lead to many non-communicable diseases which are lifetime with you. You'll have to take medicines for lifetime, and they are all killers. Salt, oil, and sugar. Dark chocolates are known to be the best. So if you do not have diabetes, start taking dark chocolates. It will improve your arousals and enhance your mood. Give a U-turn to your metabolic imbalance which is there. It's not the sex that gives you pleasure after 40, 50. It's your lover which is important. Try and use whichever position you want. There are 64 positions. Why you don't want to use them? Use which position suits you. Avoid smoking. Smoking causes erectile dysfunction irrefutably. Cancer comes later, but erectile dysfunction is there. Once you get cancer, you will die. But when you are living with smoking, you are going to have problems in sex life. So your life is a hell here itself. So stop smoking. Do workouts. Sleep deprivation. We did studies with orchidometer on doctors, and we found that testicular size reduced, and those doctors were sleep deprived. If the testes become less in volume, what will happen? There are less sperms, less testosterone, erectile dysfunction, sexomnia, etc., emotional disturbances. Touch. I find couples hardly touching each other. I call vitamin T. It promotes intimacy. It promotes trust. It gives you transparency. It is expression of truth, and so increase your romance. There is no GST on romance. Why don't you become romantic at any age? Is there a ban on being romantic after when you are 40, 50, 60? No, you have to increase your romance. I bless you all. Sada sexy raho. Do all yogas which are there, beautiful relaxation techniques you can try. But what I find today is in men, there is total, absolute, persistent disregards towards a woman's satisfaction. A man has sexual problems. He has erectile dysfunction. He has early ejaculation. He has low desire. He has got psychological issues. But his partner does not have. And he's depriving her of the sex which she deserves, of the quality of life which she deserves. And this is one of the reasons why infidelity and extramarital affairs have increased. So they are not considering the regards and the feelings of their partner. So this is what is important. There is no concept of afterplay. Once a man ejaculates, he turns himself on the other side and sleeps. He has become orgasmic. He has orgasm, but his partner hasn't. So he should, once he ejaculates, he should hold her tight, hug her, thank her, compliment her, tell her she was awesome, she was beautiful, and do everything what he did during foreplay once again. This is a must, because you need to understand that you have to satisfy her. It is not a onus on you, but yes, you have to be with her. You have to be more touching, more communicable, more understanding towards her feelings. You should have. Then only you can have a conjugal sex life, because samabhog, which is written in Kama Sutra, is equal joy. Both of you should feel equally happy, which is important. So there's no concept of afterplay. Every man uses his partner like a sleeping pill, which is wrong, which he should not. A man should always listen to her partner, should keep his mouth shut when she is talking to him. Don't give advices. If she tells something happened in the morning, don't give advices. This all happened. She wants to vent it out. She wants you to listen. Give her trust, time. Time is very important. You need to give her quality time. You need to give her quantity time. Husbands say, okay, I'm at home, but he's all the time watching cricket match or on his laptop. They both will be sitting together, but they hardly talk to each other. In bedroom also, I find they communicate on WhatsApp. This is something stupid. Share and be transparent. Because please understand, a woman is a masterpiece of God. She's the best phenomenon in the earth, in this world. She cannot be compared with anything else. Feminism needs to be admired, adored, trusted, and respected. A man who doesn't adore, trust, admire, respect feminism, I pray to God that he should get permanent erectile dysfunction. Look what Mahabharata is all about. Look what Ramayana is all about. So we should learn from our historical epics. It's all because we don't regard or respect or trust or adore or admire our better halves, which is a big lesson for all the men to learn. All these women were abandoned by their husbands, and they did a makeover. And once they did a makeover, again they were admired by them. So I advise all the women to try and look as beautiful as possible. Go to the spa, go to the Make your husband spend money. Try and look beautiful. It's always good to be charming, to be attractive. Look at yourself, and you should be admirable by all. What women should do, that is also important. She should not just watch and criticize or crib. Regard him as a hero. He is your hero. Yeda hai, teda hai, lekin mera hai. Please understand that. Regard him as a hero, whatever he is. Never give him any pressures to perform. This is very important. Love each other unconditionally. You are partners for life. You are partners. What is the meaning of a partner? Everything is yours. Both of you are one. Sexual dysfunctions can come at any age. It's not an option. But it's how gracefully you handle the process of dysfunction and how lucky we are as the process handles. That's important. The secret of sexual fitness is love your body. We all are sexual human beings. We need not be like Katrina Kaif or Deepika Padukone or anybody. Nothing, not necessary. We all are sexual human beings. We must love our body. Avoid salt, oil, and sugars. Keep a regular rhythm of your sex life. Be connected with your partners all the time. And vitamin T, that is touch, is very important. Friends, wrinkles don't hurt. Please understand, wrinkles don't hurt. All PD5 inhibitors, they do not increase the desire. 40% of them are non-responders. Testosterone is the badsha of all the medications which we have, but we need to take it with cautions because of azoospermia, heart failure, and prostate issues. So the Raja of all is L-arginine and fenugreek combination with anything which is the best, and it can give him a good desire. It can also give him good physiological erection, and they are safer. So my last 3-4 slides, the ethical perspective of why sex life can be maintained or how it can be maintained. All metabolic diseases. Today we know that diabetes can be reversed with bariatric surgery, with testosterone therapy, with having beautiful drugs like SGLT2 inhibitors and metformin and lifestyle measures. Cardiovascular disease with lifestyle measures, it can be improved. Hypertension with reducing salt and lifestyle measures, it can. Dyslipidemia, of course. So all the causes of sexual dysfunctions are there, can be reversed with lifestyle measures. We have studies of diabetes, we have studied of Dean Ornish's study of coronary artery disease. These all can be reversed with nutritional intervention itself. Even if you go in for bypass surgery or angioplasty, the disease will not get cured. But with nutritional intervention, you will not only halt the disease, but reverse the disease. So that is the importance. Cleveland study. Loneliness, of course, it is a risk factor. 20% of genes of diseases dictated by the genes, and 80% is dictated of the disease are dictated by your lifestyle. So please understand, even genetic problems can be solved with lifestyle measures. The current approach, all the behavioral problems have been solved today. But one thing which is still not solved is the healthy diet. Men and women don't take healthy diet. And that is why the cardiovascular diseases are on the rise. That is why the sexual dysfunctions are on the rise. So the doctor of the future will no longer treat the human being with drugs, but rather cure and prevent disease with nutrition. So nutritional intervention is one of the best. Today, friends, we have got a lot of things for sexual dysfunctions. It can be cured. In our armamentarium, we have so many things. It's really nice to know that erectile dysfunction is a correctile dysfunction. I advise all my patients to cultivate your own garden. Being monogamous in relationship is like a garden. Being polygamous is like being in a jungle. So you have to decide whether you want to be a gardener or a jungly. But if you want to be a gardener, you have to devote time. You have to cut the right type of grass, put water, put fertilizers, and devote time. So in a monogamous relationship, to make it a garden more beautiful, you need to devote time. You decide you want to be a jungly, you don't need to give time. You can be anything. So be monogamous, that's what. If you have sexual problems, or if your patients have sexual problems, don't send them to quacks. Oh, sirf pungi bajayega, kuch karega nahi. Send them to good sexologist. He will see that he gets good erections, etc. This is my book, Sexual Health. Sex has no expiry date. You can read it. It's available on Amazon. So my last slide, sexual fitness is a lifestyle disease. Decision which you need to make. Age, weight, height are just numbers. A heart that loves is always young. To be sexually fit is a choice you have. Low dose PD5 inhibitors and statins are ideals. L-arginine, fenugreek, and short course of testosterone can be beneficial. All sexual dysfunctions can be managed. The best aphrodisiac today is your own fantasy and your own excited partner. You don't need anything. And if you all do so, friends, trust me, sex really has no expiry date. Thank you all for your love. I'll be happy to answer any questions you all have.
Thank you so much, sir, for such a elaborative explanation. A very, very nice lecture. Thank you. Thank you so much, sir. Thank you. Vaibhav, is there any questions via YouTube or Facebook? I think, sir, there are no questions. All
Thank
are
you.
only appreciating the lecture, sir. So thank you once again. Sir, I would like to felicitate you with this a token of shawl for being in my show. Sir, please accept
Very
it.
much. Thank you. Thank you very much.
Thank you so much, sir. Sir, before we wind up, I want a one song from you.
Well, I'll sing a small paragraph for you.
Okay, sir.
The half song, the later part of a paragraph for a very good song which I love a lot.
Okay.
So I'll sing it for all of you.
Yes, sir.
रिश्ता दिल से दिल के एतबार का, जिंदा है हमी से नाम प्यार का. रिश्ता दिल से दिल के एतबार का, जिंदा है हमी से नाम प्यार का. कि मर के भी किसी को याद आएंगे, किसी के आंसुओं में मुस्कुराएंगे. कहेगा फूल हर कली से बार बार, जीना इसी का नाम है. किसी के मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार. किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है. जीना इसी का नाम है. Thank you.
Thank you so much, sir. Yeah, over to you, Harish. I think he is not here or not able to connect. So, thank you so much, sir, for coming. Whenever I requested the sir is always coming to our show. And this time, it is a huge, huge demand that sir should come because we are celebrating this month as for the teacher of teachers. So, of course, sir का आना तो सबसे ज़्यादा जरूरी था. Sir, thank you once again from the bottom of my heart for enlightening all of us.
Thank you very much.
Sir, whenever I get opportunity post-corona,